Yes.
Thank you. Awesome. Thanks, Joyce. I was hoping our co-chair would pop on, but if she doesn't pop on, we'll get started in another 30 seconds. Just want to give her a chance to join us. Excuse me. You'll have to forgive me. It is allergy season, so a lot of throat clearing and congestion and all the things. And AJS people, log on. Do you mind letting them in if anybody needs to be let in?
Yep.
Thank you. Excuse me. All right, well, why don't we get started? Because I do want to be respectful of everyone's time. But thank you all so much and welcome to our Healthy Living Work Group meeting for today. It's always so good to see you all. I know we're in our all little personal squares, but it's always really great to see familiar names pop up. But as you join, you know the routine. Feel free to type your name and your organization in the chat so we know who's with us today. I do also want to note that today's meeting is being recorded, which I believe AJ did start that for us already. And as always, just thank you so much for taking the time out of your schedules to be with us today and for your continued partnership in this work. It really does mean a lot. We can't do it without you, and your perspectives truly matter in shaping where we go next with our community health improvement plan. With that, we'll go ahead with the meeting agenda. I didn't see Devin hop on. I don't know if she's on with us. But if not, I'll briefly walk us through the agenda for today. Not hearing her. Okay, well, we're going to start per usual with just a brief moment of regrounding. We'll review our chronic disease problem statement, the evidence that supports that statement, and kind of just talk a little bit about that strategic focus for the CHIP action plan. From there, we will go straight into our action planning, so our strategy development, and talk about how we want to address our specific problem statement. And then we'll close per usual with our community announcements before we adjourn. But as always, this meeting in particular is really going to require a lot of collaboration and input. So we just encourage you to actively participate, share your thoughts, your ideas, your resources, your knowledge, your expertise, and as always, bring your perspective. So thank you all again so much for being with us today. All right. So today our focus is really on this final phase of the CHIP, which is our strategy development. And our goal today is really to take everything that we learned through the data, through our discussions, through our community input, and then now translate that into some actionable strategies that we can implement together. And before we dive into that, I do want to just quickly review where we are, where we've been, and what we've done to bring us to this point. And again, like I say, this just really just ensures that we have, excuse me, just that shared understanding, especially for our new participants. I see some new names in the chat, so it's really cool. For anyone who may have missed a previous planning meeting, it just helps us to kind of reground. So with that, our problem statement that was selected by our CHIP steering committee really just highlights preventative care utilization. And the data says that, that there is a strong need for early screening, for maintenance programs, for resources in the built environment to help provide that comprehensive prevention for chronic disease. So everything from access to healthy foods, safe active living environments, access to resources, all of those things. And from last fall's, excuse me, root cause analysis discussions, we did identify several possible starting points to address this issue. But instead of focusing our efforts on a lot of different things, we chose to focus on one meaningful and feasible starting point, something that we felt aligned with existing efforts. And so we polled the group, and the majority of you all wanted to prioritize focusing on that built environment and healthy living support. So everything from, strengthening the access to healthy foods, safe physical activity, and especially prevention supportive environments. And that's kind of where our conversations have taken us. So from there, we discussed, what success could look like over the next 3 years. We identified several common themes that came out of that conversation, and we used those themes to guide the drafting of our goals and objective statements. So there was conversation around community engagement, early detection, how can we improve access to care and resources, how do we make clear, consistent health education across partnerships, messaging across partnerships, and then that intentional coordination across partners as well. And those draft goals and objective statements were shared with you all, and then we requested your feedback via survey, and that brings us to where we are today. Based on the feedback from that survey, you all want to prioritize specifically how to increase access to preventive care utilization through health education, through screenings, and early detection. And so with the help of our co-chairs, we drafted some SMART objectives to align with this, which you all were able to see in that survey as well. And they're here on your screen, but just to briefly review that for those who may not be able to view their screen right now, Objective 1 was to increase participation in preventive care screenings and annual wellness visits through expanded community-based screening events and targeted promotion efforts. And then our second objective for this goal was to improve community awareness around preventive health practices and chronic disease prevention resources for populations who often face barriers. And that's through tailored outreach, through tailored education, and support services. So your ideas have been invaluable throughout this process. And now that we have our focus goal and objectives, we are moving into action planning. And this is where we get to dive deeper into strategies, looking at how exactly we want to implement these strategies, who takes the lead on some of these, what partners do we get involved in these efforts, what are the specific action steps we want to take, and then how we want to go about measuring success. And so we're going to use an action plan template, which I'll share with you in a moment. And we'll go through that together to kind of organize our ideas. And what we're looking for to you all for is really just suggestions on each component of the action plan, helping us identify those specific action steps. Again, how we're going to measure that success and what time frame is realistic, right? So we know that this chip is a 3-year cycle, but maybe there's a specific action step that might only take 6 months to accomplish. Maybe there's something that we have to break down in steps over the 3-year cycle, and that's fine. We have that flexibility. But your input is really going to be what makes this plan practical, makes it measurable and impactful. So again, we're going to be looking to you all for this feedback. So I'm going to go ahead and share that template with you now. If you can just give me a moment. And what I've done, you might have to pop out your individual screens to enlarge it a little bit. I'll try to make it as large as I can on this side. But I've pre-filled some of the areas for you. So like we know our priority health area is chronic disease. This is obviously our healthy living work group. And I went ahead and pre-filled the goals and objectives, as well as the expected outcomes. Okay, and so what we're going to do is we're going to utilize the next 2 meetings to really work through this template together. And again, we'll go through each component together. So I do want to first look at our goal, right? Our first goal, our goal says that we want to increase access to preventive care utilization through health education, screening, and early detection. So looking at this goal, my question to you all, and open to feedback, does this goal feel clear? Does it feel meaningful for addressing chronic disease in our community? Is anything missing? Anything unclear? And you can utilize the chat or you can unmute yourselves to speak. And I see Carol with her virtual hand. Yes, Carol.
Hi, yeah, I just wanted to kind of hone in. Are we spoke focusing on a specific demographic of people, like age groups, or just as a whole, Prince George's County increasing access?
Yep, so that's a great question, and that's kind of where we are today. So I think it would be wise to hone in on a specific population, but this is you all's plan, and I didn't want to make that decision myself. So we can open the floor for those ideas, for that conversation. I'm definitely open to that.
Okay, thank you.
Sure. So maybe we want to specify in our action steps or in our objectives those specific populations. I know we talked about those who experience barriers, but maybe we want to get a little more specific. Any other feedback? Okay. Well, hearing none on the goal, let's go ahead and move to the objective statement. Now, this is just our first objective statement. And I know we had some place fillers here, so you'll see the X that kind of holds the space. But by a specific date, we want to increase the percentage of Prince George's County adults who complete recommended preventive screenings and annual wellness visits by a certain percent, as well as participation in preventive screenings and annual well visits by X% through expanded community-based screening events and targeted promotion efforts. Yes, AJ.
I'm thinking for this one, it may be a little repetitive when I heard it said out loud. Increase the percentage of Prince George County adults who complete recommended preventative screenings and annual visits by X%, as well as participation in preventative screenings and annual visits among Prince George's by X%. If they complete the recommended preventive screenings and annual visits, they're already participating.
Okay.
So it may actually be good to either one of those if we want to do complete, or actually it may be good to just, again, I'm thinking about us kind of starting this out for our first time. It may
Mhm.
be good to go with just participation instead of completion, but have that potentially be um, a measure or a metric that we include in the future, and go with participation, increase the participation in preventive screenings, annual wellness visits among Prince George County's by X% through expanded community-based screening events and targeted promotion efforts. So it's basically one thing and not kind of redundant. And then
Yeah.
also give it participation so that, for one, we understand it's real life. Some folks may not be able to complete a whole entire, program, 6 weeks, 4 weeks, or whatnot. Maybe they just started, but that's something we can track, and then we can start focusing on how to get them to completion.
Okay. I think I agree. I think it is a little repetitive. Any objectives to simplifying this language to those to just participating in preventive screenings and wellness visits? Okay. So for adults who participate, oh gosh, sorry. And thank you for that, AJ. Okay, great.
Kelly has her hand raised.
Oh, I'm sorry. Go ahead, Kelly's.
Hello. I think I wonder if there could be a little bit more specificity regarding chronic disease,
Sure.
since that is very broad and that could help dictate the population that would be focused, that would be the focus, and even kind of age group.
Okay.
And that may help with kind of specificity with the objectives.
I love that. So I know in our initial talks, we talked specifically about focusing on the adult population. And the idea was to kind of keep the goals and objectives semi-broad, but getting really specific in those action steps. So if, one of your action steps wanted to be, we want to, I don't know, promote prostate cancer screenings, right? Like that's kind of where we get specific, but I'm open. This is you all's document. So whatever you all think is best, I'm open to hearing that feedback and making those adjustments.
Yeah, I think just piggyback off of what you said, Sinead, it may be good to kind of have that, as you said, semi-broad approach for the goals and objective, right? So we can kind of have that umbrella, but then
Mhm.
for our action steps, is where we get incredibly specific and we get a bit more, we lock in on some of those things that we want to specify on or whatnot. That will again fall under that umbrella for our goal and objective.
Okay,
Taylor has her hand raised.
Taylor.
Hey everyone, good afternoon. Just going to jump in. We could also look at it through targeted zip codes. So
Mhm.
if we look at where chronic disease prevalence, where we have elevated chronic disease prevalence, I know we've been tracking that data through PGC Health Zone. That might be how we could get a little bit more specific if we don't want to go so far as saying demographics at this point, if we just want to focus on specific geographies here in Prince George's County.
Okay, for objective statements or specific to the action steps?
I either or. I think for like the specific action items, we're gonna, that's where I think we can get specific in naming the actual zip codes that we'll have, we'll focus on. But I think in the objective statement, I think we could also stay in, census tracts of highest chronic disease prevalence. I don't think that would box us in too far.
Okay.
But of course, open to the group's feedback and how others may be thinking of this. I know Joyce, coming from the hospital setting, not sure if you have, you know, if you all are thinking through it through geography or any specific demographics, or I don't know if we have any of our FQHCs on, but would also be curious, if how we should be thinking of this.
Yeah, I love that. Any feedback? I know Joyce is on with us.
As I was on mute. I'm kind of just thinking through it right now.
Mhm.
I do like the idea of being a little bit more specified with the chronic disease population. I'm just kind of, I have to kind of process it for a
Process.
minute. So, so give me a minute. I'll get back to you.
Okay, no problem. I'll just include the note. I know red's not the best font, but that's okay, Devin. Thanks for joining us. But just for my awareness to kind of update that language a little bit there. Okay. Well, thank you for that feedback. I think we can go ahead and kind of work our way down. We can always come back. If thoughts come later, we can always jump back to anything we've previously discussed. Okay, so kind of moving on from that, so we have our broad goal, the first objective we want to look at, and then thinking about what our expected outcomes are when we address this, right? If everybody can mute, that would be appreciated. Sorry. But based on the expected outcomes that are listed, do these seem to align with what we hope to achieve in the general sense as it pertains to this specific goal and objective? And these are just some examples just to kind of get our thoughts flowing, but I'm open to additions, to taking things away, to reworking some of the language. But just some examples to kind of get our brains flowing here. So we have increased community awareness of preventive care and early detection, higher participation in screenings and annual wellness visits, improved access to culturally appropriate health education, and strengthened community partnerships for preventive health initiatives. So does this seem kind of reflective of what we want to see? I'm sorry.
Danae, I'm wondering if for the targeted promotion efforts, if we should have a specific outcome that measures the promotion side of things. So whether that be if if we're going to work with providers to get the information out, if we're going to put up billboards, however
Okay.
we would want to measure that effort.
Okay, so can you give me kind of like some sample verbiage that you're thinking?
I guess it would be more so of a process measure. So this is going to be like the number of outreach attempts, or something. I don't know what I'm thinking yet, just for the targeted promotion efforts.
Okay. I'll just put a note here.
Yeah, Taylor, if I'm at an pop in, Sinead, maybe like that just fits more into
One of the
measures,
metrics.
not
Yeah.
an expected outcome.
Okay,
Taylor, does that make sense for you?
it does.
Kind of-
Yes.
Okay. All right, no problem. Yeah, I think again, these are kind of like, how we're always kind of like starting out here, starting more broadly and then kind of narrowing down so we can get into the specifics of what exactly we want to look at and how we want to measure that. Kelly, I think I saw your virtual hand and then it went away.
Yes, you did. To Taylor's point, that can maybe that's captured in increased community awareness in terms of part of the targeted promotion efforts.
Okay. And then I heard some of that language around working with the community partners. So I was leaning more towards that strengthen community partnerships bullet as well, but I can see your point too, Kelly. Okay. All right. Any other thoughts on expected outcomes before we move into specific action steps? I always think this is the fun part. Okay. All right. Hearing none, let's go ahead and move on. So thinking about our objective and our expected outcomes, our goal, again, just an example, just to kind of get our brains flowing. But one of the action steps that came up in the discussion from previous meetings was working as a coalition to promote other prevention screening events. Are we hosting one? Do we want to plan for one? And so kind of taking the language from previous meetings to create an example action step. Again, not married to this, so feel free to tweak, to add your own thoughts, and kind of go from there. And then moving along, we'll talk about how do we measure that, what's a good timeline for that, and how we'll track our progress. But any thoughts or ideas? Taylor, I know you kind of were thinking about a targeted promotion approach.
Yeah, just digesting this one, Shanae.
Mhm. So as we think about ideas for specific action steps, some things to consider might be, like, has anything worked well in the past? In your experience with your organizations that should be built into this approach? Is there something we can expand on, something we should change if we were to do it again? And what those specific activities look like. I see AJ's comment, develop, implement, or promote targeted outreach campaigns to promote screenings and wellness visits. As an additional action step, or to tweak the language that's currently here?
I almost think it should be a standalone. I mean, I'll invite AJ to give his thoughts for his comment there, but I'm almost envisioning this being its own communication plan. We could use some of those reflections from COVID. I know we had, especially as the health department, we had a lot of success with targeted outreach. So deploying some of those techniques that we used. But I think anything that we can kind of coordinate and document in regards to a communication plan will help us for future endeavors and also to evaluate the success that we have here.
Great, love that. Thanks, Taylor.
And then metrics that can go along with that. It can just be number of campaigns, number of outreach efforts, maybe even that. Maybe actually we can change campaigns to efforts, because that again just gives us a little bit of more of an umbrella. So number of outreach efforts, and then if we want to have another metric, that can be Right. If it's through social media, maybe folks have access to those metrics. So, right, number of those reached. If it's in-person things, right, it'd be number of residents reached, but basically some form of reach. So yeah,
Okay. It's like reach, click rate, something like that.
those kind
We
of
can,
things.
yeah, we can look into those metrics.
And then our partners, if they do any promotional efforts, right, if they have access to that on their end, that's the kind of things that they can share with us that again helps the whole entire coalition achieve that goal for this work group.
Okay, so would you consider that a metric as well, like number of partners engaged? I don't know, I'm trying to think of verbiage too, but number of partners, essentially that we might be uh, who are actively promoting
No,
these
no.
campaigns or whatever.
So I don't want to we don't want to get too heavy on this when it comes to those metrics, so maybe just those two, but then another action step can be specifically partner based. So then
Okay.
that one, those metrics can be right number of partners, potentially joining the work group, number of partners, hosting events, like things like that. So then we can actually get into our partner, what our partners are doing. And hopefully right during the discussion with you all, this will be things that you're already doing. And then we're just capturing so that we can see how we can augment it even better.
So collaborate with partners to promote health education campaigns or messaging. And again, we can clean up the language a little bit once we, once we kind of go back to this. But is that sort of capturing what you were thinking as far as an additional action step?
Yep, yep.
And then the metric would be,
Right, number of partners, right, things like that.
Okay.
And then the second one can be we can work on this.
Yeah.
I think second.
Oh. Do these action steps feel feasible to the work group? Does it feel like these action steps will help us reach our, any priority population specifically? Do we want to specify what those priority populations are? I know we talked a little bit about the demographics, we talked about geography. So do we want to tweak the language here to get into those specifics? Taylor, when you all were doing your COVID campaign, when you had those action steps in mind, were you specific to geography there, or was it more like population-based demographics as far as age, gender, those kinds of things?
It was geography. In my experience, geography's always been a little easier to evaluate because you can assess the partners that you're reaching out to in that specific census tract. Like any sort of campaigning activity, if we had a billboard or if we were running a radio ad for a specific geography, it made our lives a little easier. So just in my experience, using geography makes your life a little easier when it comes time to evaluating these messages and the reach of your messages.
Yeah, love that. Okay. So if you were to, I guess, incorporate that language in these action steps or even in the metrics, like is there, are any of these action steps something that you could tweak to kind of incorporate that geography language?
Yeah, honestly, I think it's almost as easy as just kind of tacking it onto the end of the sentences, really just in those areas, those I don't know if we want to look at it through census tracts or zip codes, kind of whatever the group is thinking of high diabetes prevalence. I think for both, I would probably put it in the action item as well as the metric.
Okay. And what are you using? And this can be for Taylor or really any of our hospitals, our FQHCs, our other partners here on the call. What, I guess, databases or what resources are you using to kind of gather or gauge which census tracts, which zip codes, which demographics to look at?
Yeah,
what you
so
can.
we're pulling things straight from PGC Health Zone. What we do is we go through and we pull out. So we look at things through diabetes, of course. Coming from my program that I support here at the health department. So we take the county's average for diabetes prevalence, and we look at which census tracts have higher rates of reported diabetes than the county's average. And those have become our priority census tracts for outreach and enrollment in our programs.
Got it. Any other resources from any of our other partners that we should consider? Any other demographics we should consider?
And Shanae, I'll just mention, I think it's called CDC Places. I think that's also a good opportunity to get to drill down on health data at the zip code level.
Okay, great. I've actually never heard of that one.
So if I can find some specific links, I can pop them here in the chat if anyone's curious and take a look.
You're the best. Thank you. Any other feedback? All right, so just to kind of quickly recap, so we have our first action step is to plan, promote, or host preventive screening events in partnership with our coalition partners, health systems, and our CBOs, potentially using census tracts or zip codes. And then the metrics that we want to consider for that would be the number of adults completing recommended preventive screenings, as well as the number of adults, the number of community-based screening events held in those specific zip codes. And then I see another note for a number of outreach efforts. So how are those metrics? Do you think those metrics work for this specific action step? Is there anything else we should consider?
Shanae, do we want to have something that gets at the fact, I'm thinking of these folks who are going to attend these screening events. Should we be asking how they found out about the screening event and have a question that's specifically getting at, did you get an ad for this? And have that come back to our evaluation. So, to say like those folks who are actually completing the screenings, were reached through the campaign, for example.
Yeah. Okay. I'm writing notes in 2 different places. So using that as a metric, let's see. So what is that, like number of participants who attended via whatever, our targeted outreach. And we can clean up the language there a little bit, but
yeah, I think that's a good start. My brain isn't firing on all cylinders
I
today.
know, but this lunchtime hour is always tricky for me. So yeah, I'm with you there.
Yeah.
Okay. So that just a placeholder. And again, we'll clean up this language a bit and share it back out with everyone for additional feedback. Okay. And considering this, do we already have somewhere we can go or any knowledge of already existing events that are being held? Is there's like it's for our baseline data, and maybe we don't have those numbers, but is anybody familiar of where we could maybe find those numbers? Are we just looking specifically via our coalition partners for these outreach campaigns and events? How do we want to go about identifying our baseline? And then from there, what is our target, right? Because we know there's lots of events that are being held. So what is our current starting point? And if that's unknown, how do we want to establish that? And then moving from there, what is a realistic target target goal for us. Oh, and I see, I'm sorry, I have the chat box on my other screen, but I see your comment, Joyce. Thank you for that. Retweaking the language for our objective. Let me just kind of go back up here. Increase the number of Prince George's County adults, especially those most affected by chronic disease, who participate in community-based chronic disease screenings and annual wellness visits by expanding screening events and targeted outreach efforts. Love that. Yeah, I guess we will need to change percentage, so I can tweak that. Scan those. Okay. I'll note your comment, Joyce, and make sure I update the language for that. But I see some thumbs up there, so I think others in the group are in agreement with you. So thank you for that.
Problem.
Deborah, I see your comment. Thank you for that. Okay, awesome. All right. So yeah, so let's go back to our baseline and our targets. And Deborah, maybe this is a question for you as like our data expert. Like, you know, especially as a data expert, like where do you go? What kind of resources do you tap into when you're trying to determine baselines and target goals? Or for anyone else in our group? Any thoughts on that? And if we don't have a target, that's okay. We can leave that as NA for now. But considering this first action step, what do you think is a realistic or a meaningful goal for us? Remember, we have 3 years to do this. So, you know, do we want to look at this annually? So each year we want to, you know, I don't know, promote 5 events. You know, is it 1 per quarter? You know, what is realistic for our coalition?
I
I
guess
think
the
that's where it
question.
get. Oh, go ahead.
Oh, go ahead, Joyce.
Go ahead. Go ahead.
Oh, AJ.
I was really just gonna. We may be actually about to say the same thing, but that's where my question would basically come into. What are you all, right? Our partners. What are you all already doing, right? What events do you already maybe annually host, even if it is one annual event? Okay, well then let's add that one event. That's perfect, and then let's make sure we promote it as much as we can, so that's as reaching as possible. But I'll cut it off there. Go ahead.
Yes, my question is like, what systems in place do we have to that we are already assessing information with our partners? And are we able to leverage that to be able to do this activity as well?
That's a great question. I'm actually going to put Taylor on the spot here, but in your experience with the coalition before, with the previous CHIP cycles, I guess kind of, you know, how would you respond to Joyce's question and what you've done in the past?
I would say historically we have steered away from baseline numbers. If we were coming in like as the coalition and just starting something, if we are going to be uplifting community partners existing events, I would say that we would need to get those folks in the room to understand their experience of the numbers that they are seeing and establish that baseline, and then almost kind of pre and post intervention, if our intervention is going to be, you know, this awareness campaign, then we could kind of assess, okay, what are they averaging before, and then what are they averaging after this outreach campaign that we have. So I think in the cases in which we actually, as the coalition, are going to be hosting and sponsoring these events, I would say knowing kind of baseline is going to be challenging. And then for the partners, I would say we would need to bring those folks to the table to understand their experience, you know, kind of in this post-COVID world. But then also we want to make sure that we understand their participation limitations. So for example, you know, if they only have supplies that they could do 50 screenings and they're maxing out at the 50, you know, how do we react to that? Because no awareness campaign is going to increase the number of materials that they have to increase their screenings. So just understanding those limitations. But in terms of having kind of this pulse on things going on across the county, I think that that's an ongoing challenge. I think there are just so many different organizations. I know county council members are always having events as well in their districts, and there are just so many things going on. So I would say, you know, kind of there's a lot of pre-work that I think will come with this action item that the coalition will, or that this work group will have to think through of how to engage those leaders in the space of who's having the events and understanding it. So, you know, I would say this action plan, I would say more so than ever, is really just going to be a living, breathing document. So if it's a situation where we almost have to kind of get into the work and have some of these conversations and then create the targets as we go, I think that's where we can all be a little flexible.
I love that. And thank you for that. And I honestly, I agree that that's the beauty of having this living document, is that we can be flexible. And again, if we don't have the answers to this right now, that is okay. So yeah, thank you for reiterating that, Taylor. And I think, you know, with that, then let's kind of we'll kind of move past the baselines and target for this one right now. We can always go back to that. Same thing with start date and end date. Like, these are all just, again, just a snapshot, just a quick example. Nothing is set in stone, living document. So yeah, these things can change. And as we get into the work, like maybe the first year of this specific action plan, or the first 6 months, right, of this specific action step is gathering that data, right? And then I think that that's an approach we can take if we don't have the answers to that right now. And then moving on from that initial 6 months, maybe we can, you know, decide what that target might be. If it is one a quarter, or is it a biannual thing, or, you know, once monthly. I mean, that's a lot, but, you know, we can make those determinations once we get that information. So thank you for that insight, Taylor.
Yeah, and you know, I'll just say, like, the target may not be the most, you know, evidence-based thing that we create as a work group. Maybe it's a thing of just assessing capacity, and then, like Shanae said, you know, putting that on our as our target for the first year, and then seeing how we react to that. Do we exceed it? Do we match it? And then, you know, going back to the drawing board for year two. I would say something that we didn't have in the last chip was really the kind of this mechanism to update it on a yearly basis and really kind of reflect on the successes and you know, reframe some of what we've accomplished in terms of targets and even additional action steps. You'll start to create that along the way.
Yeah, love that. Okay, great. So then again, with, I guess, with this in mind, you know, maybe an additional action step would be to kind of gauge or gather that information on, you know, what already exists, what's missing, where are there gaps, you know, are there screening events that aren't often promoted, that maybe we can do better at, you know, if, for instance, like cervical cancer, are there, you know, any educational campaigns about that? Are there any events about that maybe we can kind of help bolster, you know, if we see that there's gaps in something like that? Joyce?
Yeah, I'm just kind of putting on my project management hat. So what would success actually look like? Would it be building a certain structure that would be able to collect this data and then be able to, I guess, be able to see the progress. And is that actually, is it doable? I mean, are we able to do that at what level? Like, what level of data do we think is actually doable?
Yeah.
And would that actually match the outcomes that we have listed here? Are we able to do that?
And this doesn't need to be added, but to both of their points, um, right? Like our metrics, right? The number of community-based screening events happening, right? The number of chronic disease prevention workshops, like anything like that, right? We're just gonna need the community partners here to actually know what they're doing. And then I do genuinely think, honestly, just from past experience, having the community partners here, usually they'll report the events that they've had. Hey, how many events have you had? And then they'll say, here are the events that we've had. So then we can actually have that metric. We'll know those kind of numbers, but to the point is we have to have those people in the room to know those numbers. So I think that's what we'll have to work on, Shanae.
Okay. Sounds great. That kind of goes back to Taylor's point. Okay. All right. Well, we'll go ahead and we'll just kind of nix baseline and targets for now. Again, kind of go back to the drawing board and think about how we want to maybe collect that information. But just to kind of recap a little bit further, so we talked about our first action step and some of the metrics for that. The second one we discussed is developing, implementing, and promoting targeted outreach campaigns to promote specific screenings and wellness visits, again, based on, whether that's census tract or zip code data. And to measure that, we discussed the number of outreach efforts, number of social media engagements, so whether that's the reach, click rates, things of that nature. And then the last action step is language around collaborating with our partners to promote health education campaigns, specific messaging, again, based on geography. And the metric for that would be the number of partners that we're collaborating with. Anything else, any other metrics we need to consider for these these last two action steps? All right, so what we'll do is we'll go back and kind of, again, just tweak the language based on the conversation. We have this recording, we have the transcript, so we can engage with those and kind of tweak some of the language based on the conversations that we've had today. And then I can share this out with everybody. So if you have additional feedback, I know I'm one of those people, I have to see something a couple of times to process it and really kind of come out with those ideas. So I'll make sure to share this out in the follow-up email for those who want to take a look at this and process a little bit more. Feel free to respond back to me personally, to AJ, to the PGHAC email with any other thoughts or ideas. And then we can consider that for our action plan as well. So this is just the first objective. And at next month's meeting, we'll kind of dig deeper into our second objective as well. But I did just want to thank you all just for just the engagement, for sharing your thoughts and ideas. It is helpful to kind of hear what other people are thinking based on their experience with project management, project planning, with their work out in the community and their professional experience as well. So I really do appreciate you all for engaging in this with us today. And on that note, I am going to turn it over to AJ to briefly review our I'm not sorry to review, to share our community announcements. Just give me a moment, AJ, and I'll share that screen. And whenever you're ready.
Okay, so starting off, join the Prince George's County Health Department for meaningful conversation as we work together to improve colorectal cancer health outcomes in our community at the Roundtable for Colorectal Cancer. It's going to be Thursday, April 9th, 12 to 2 p.m., and we will make sure that the registration link is shared with you. Next up, we have Dine, Learn, and Move. This is going to be the April class offering is going to be Smart Screening for Colon Health. It's going to be Wednesday, April 22nd from 6 to 7:30 p.m. The email to register is on the slide, and we'll make sure that the hyperlink is shared with you all. Come out and play. Sorry about that. Excuse me. Where's the Prince George's Mental Health Champions are hosting a free ice skating event for all ages at Bowie Ice Skating Rink on Friday, May 1st from 6 to 8 p.m. You can email the email address on the slide or scan the QR code for more information. Next up, we have the GOAT Youth Mental Health Expo. So you can join the GOAT Expo team on Saturday, I think it's May 2nd, at Bowie State University for a full day of workshops, resources, live performances, and support for youth 16 to 25 and their families. This event is free to attend, and you can register via the link on the slide. Next up, we have request for partnership, health screenings at the Senior Informational Fair. This year's Older Americans Month theme is focusing on prevention, wellness, and personal responsibility as essential components of healthy aging. In support of that theme, we believe offering preventative health services during a fair would provide meaningful value to participating seniors and reinforce the importance of proactive health management. If feasible, we would be grateful for consideration of any available screening services, such as blood pressure checks, blood sugar/glucose testing, cholesterol screening, vision and hearing checks, bone density or osteoporosis risk assessment, or fall risk assessments. For more information, you can contact Warren Wilson at the email provided. Next up, we have the Spring into Wellness Behavioral Health Expo. Your Prince George's County Mental Health Champions will be hosting this expo on Saturday, May 16th at Southern Regions Technology and Recreational Complex. Join them for a free interactive community event aimed at offering behavioral health and wellness resources to adults and youth at every stage of life. Featured activities include a farmer's market, free food demonstrations and samples, live fitness demos, free health screenings, entertainment, and educational experiences. Last but not least, join the Alzheimer's Association in Parks and Recreation on Saturday, May 23rd from 1 p.m. to 3 p.m. for a brain health event focusing on how to reduce risk and build resilience at every age. This family-friendly event, offered virtually and in person, will bring together experts and neighbors to discuss practical tips for reducing risk and building resilience and share experiences and ideas to better support families and individuals affected by Alzheimer's in our community. Register for the event today, and we will make sure that information is shared with you. Thank you all.
Okay.
Oh, I'm muted. Sorry. Thanks, AJ. Let's go ahead and open the floor for any additional partner announcements at this time. Hearing none, as you all know, you can go ahead and email those to me if something comes up so I can share with our work group members, not just in this work group, but all the work groups. I typically share across the coalition. So feel free to send those events and those that information my way. And if you haven't yet, as always, please go ahead and scan the QR code, and we'll make sure you have the link to update your contact information for the coalition. So that we have everything up to date and accurate. Oops. And then our next meeting coming up will be on May 6th. So if you are available, please feel free to attend that. I know we typically meet bi-monthly, but we're just trying to get through this CHIP cycle, which is almost done. So we appreciate you all hanging in there with us and adding additional meetings on your schedule. But same time, same place on May 6th at 12 p.m. And as always, thank you so much for just your collaboration and your partnership. Again, we can't do this work without you all. And we just look forward to continuing this work moving forward. We're getting so close to the finish line, everyone. So thank you again for hanging in there with us and for your patience as we navigate this process. But I hope you all have an amazing afternoon. For those who celebrate Easter, happy Resurrection Sunday, and enjoy the sunshine. Have a great day, y'all. Thank you.
Should I stay behind real quick?
Sure. Go ahead and end the recording, please. Thanks, Taylor.